to take us through the funding schemes and what feedback that we've had. I'm just trying to minimize me. There we are. That's right, so I don't have to look at myself as well as the slides. So I just wanted to take us through the funding schemes that you guys will be applying for, and to think about feedback that we've had on how those applications have gone, particularly from unsuccessful applications, and hopefully that will help you think about your applications. So these are the main funding calls that are open at the moment. So we've got the main one, the RFPBB, the Research Time Award and the Health Research Grant that are open and are due to close in the last week of October. Then there's the Social Care Fellowship, which is open until the 8th of December. And the RCBC, I think the RCBC Fellowship is closed. Well, the people will have applied for that now. But the First in Research is open until next week. So those are the main calls. Without wanting to sound like a teacher preparing you for exam, I would suggest that you read and reread the guidance, because it's there's an awful lot of information in the guidance notes for each call. So it does give us quite a lot of helpful information. So I would suggest that you scour through the ones for the scheme that you're applying for. The schemes that are open now, there are several of them that have a two-stage process, and there's a really different focus at the different stages. And before I go into the stages, what I would suggest is that make sure that you've talked to your R&D department for their dates. Because whilst we've got the dates for Health and Care Research Wales, the R&D departments will all have different sign-off dates. So you need to check the date for your organisation's submission date. So at stage one, what they're really looking for is the importance of the research question to healthcare. So this is less about the idea itself, and it's more about whether this is an idea that they want to prioritise. So then what you will hear about is whether you've been successful to go to a stage 2 in December, and so that's a bit of a Christmas present for you, because that's what you'll be doing over Christmas, because then the submission date is February. And then at stage 2, they're much more focused on the scientific merit and whether your research is feasible and good value for money, and that decision is made in July, but you have to be able to start on or before the 1st of October 2021. So what are the questions that you need to answer at stage 1? What you need to be showing is that there's a gap in the evidence that exists already, and you need to be able to show how your work will fill that gap. And which population is it going to be of benefit for? So Phil's going to be talking about the PICO design later. So what population are you likely to have an impact on? And does your research have the potential to influence current Welsh policy? So obviously buried within that is an understanding that you really know where Welsh policy is at the moment and what current practice is. And will it help decision making in the NHS? So really, does it change things for patients? That's a crucial question. Just some practicalities on the stage 1, because stage 1 has only been in place in Wales for the last year. So some of this came as a bit of a surprise to those of us that completed an application last year. Be really clear about which sections are seen by which people in the panel. One of the things that happens is you think you're being really repetitive, but actually different people see different sections. So it's good to make sure that you repeat the critical bits for the different readers. What you write at stage 1, if they do it the same as they did last year, what you write at stage 1 will come through into your stage 2 application. So be careful, because what you say now will stay with you through the whole application process, because it gets auto-filled and you can't change it. And with the costings in the guidance, this is something you need to talk to your R&D department about. In the guidance, it says that you don't need a total, but you just need to decide which costing bracket you're in. But actually, several organisations won't allow you to submit, won't agree to it being submitted without having seen fairly detailed costings. So that's why we are talking about costings today. So thinking about what the reviewers want to know about, essentially they want to see that you've really made the case for an intervention, for the intervention that you're proposing, and if that's not made convincingly, then they will knock it back. Barbara and Claire are going to be talking about patient and public involvement, and that is really crucial to these applications. And they want to know that actually that this research needs doing and that you are the team to do it. They need to know that you have really grasped the current research arena, that you really know what else is going on and that it's going to make a difference to NHS practice. And although it's not their job to talk about or to respond to your design and methods, we have seen feedback on stage 1 where they have said that the methods that you've chosen aren't appropriate for the question that you're asking. So the design and methods that you will have as part of your stage 1 will be considered, even though it's not, in theory, part of the prioritisation panel's job. So part of the information that you're going to be putting into stage 2 does affect how you write stage 1, because obviously you've got to have the design in your head. So what we need to do is to make sure that your research question really is an area of priority. So we're going to be talking about research questions in a bit. There are obviously the COVID themes, but don't try and squeeze your question to fit the priority. If it doesn't fit, don't try and make it fit, because the panel will spot that you've tried to kind of fit a square peg into a round hole. Make sure that you're clear about the background, that you're really building on previous literature. And if your area of expertise, if your specialty has a core outcome set, these are measures that are used in randomized controlled trials, and that the idea is that everybody uses the same core outcomes. So if there is a core outcome set for your area, make sure that you use it in your study. And what you need to do, what they're asking for often is maybe that you've done some previous work on the same area, but make sure you've been really clear about what you've learnt from the previous work in terms of how maybe your intervention works, to really clarify the intervention. So don't just say you've done it and this is the next stage. Really be clear about what you've learnt from that first study. If you've got treatment as usual, the danger is just saying, oh, it'll be usual care. So you need to be clear about what usual care is. And if you are doing a feasibility study, make sure you use that term all the way through and that you're consistent, because there are particular kind of research design questions that come from it being a feasibility study. And also make sure you've got a good balance of clinical and research skills in your team. If there's the great and the good, so the really kind of eminent professors in your area, they make fantastic collaborators, but they're very expensive. So if they're prepared to help and support you, but realistically won't be able to offer a huge amount in terms of time, then it may be that they're better as collaborators rather than co-applicants. If you are doing anything statistical, in terms of knowing how many people you're going to be including in your study, be clear about how you've come up with that number. And similarly with qualitative methods, you need to really think about, don't just say you're going to do some interviews, have a think and try and articulate what it is that you're doing and how you're going to be approaching that. I've talked about core outcome sets. If you're doing lots of different bits of work, so for example, if you are using some routine data and you're using data that you're collecting through interviews and you're also doing a literature search, be clear about how that information is going to be brought together. We'll talk about patient and public involvement later, but it's really clear that the panel will look at how you've costed that and make sure that you are actually costing it appropriately and that you've made it clear about how patients and public that you've had involved have actually contributed to your idea. Don't dodge the ethical issues that may come about. I mean, particularly, for example, in terms of qualitative interviews, you need to be aware of the impact of doing in-depth interviews with people on them, and really think about whether whether it's realistic to do the work that you have suggested that you're going to do in the time scale that you have given. 2 years is really not very long, particularly taking into account things like ethics, which can take several months to do. And with your dissemination, try and be a little bit creative about how you're going to be sharing the findings of your research. I've been successful and unsuccessful as an applicant on these schemes. So I've had a Research Time Award, but I've also submitted several unsuccessful applications. And just a few reflections on what that's like. When you get a knockback, you know, you've really committed lots to this. It will feel really unfair. And often at stage one, the feedback is really minimal. So they'll just say, actually, it just didn't make the grade. And that can be really tough because you think, well, you know, this is a really good application. But sometimes it's simply a matter of the cutoff. So it may be that you have got a good idea. You just didn't quite make it over the threshold. So it may well be worth pursuing. Sometimes when you put it away and you come back to it a few months' time, you realize that actually they were right to knock it back and that, you know, there are many ways that you could improve it. But also be mindful of the fact you may just get funded. So be sure that actually what you are writing and what you are proposing is something that you really are confident that you can deliver. So I think those are the key points. So I don't know if anybody has any questions. Or are we happy to go straight on to Phil?